Welcome back to the training Creating a Trauma-Informed Library. We're now in Module 2, Trauma Manifestation. This is Lesson 4, Trauma Manifestation and Mental Health. One concept in how trauma manifests is a concept that most people have heard of at a basic level: fight or flight. While those two are the trauma reactions discussed most commonly in pop culture, there are actually 4 trauma responses currently identified: fight, flight, freeze, and fawn. When a traumatic event happens, someone may experience one or multiple of these responses. In most cases of trauma manifestation, a person's logical brain will be suppressed by the more basic responses that someone may not have full control of. The fight response can be literal, like physically lashing out and hitting someone, or it can be more figurative. The fight response can show up as irritability, anger, aggression, or confrontation. The flight response can show up as someone literally running away from whatever is scaring them. More figuratively, the flight response can show up as anxiety, avoidance, panic, or perfectionism. Freeze very rarely means literally freezing in place, though that can happen. Usually, the freeze response shows up as someone dissociating, being unable to make decisions, feeling numb, or isolating themselves from others. Dissociation can be as mild as feeling like you are watching yourself or your mental processes, or it can be as severe as no longer feeling connected to your body and losing track of time. Fawning is the people-pleasing trauma response. This response can include prioritizing others' needs above one's own, having trouble saying no or setting boundaries, feeling overwhelmed, or avoiding conflict at all costs. While fight, flight, and freeze responses are people's natural responses that typically occur as a result of typical neurodevelopment and predisposition, fawning is the newest response to be identified, and it occurs as a result of environmental impacts. For example, people raised female tend to exhibit the fawning response more often because that is a learned way of avoiding physical harm and attempting to appease a physically dominant aggressor. Library staff are not trained to diagnose anyone with a mental health condition. However, learning about the mental health conditions associated with trauma can help library staff understand what patrons may be experiencing. Acute stress disorder, or ASD, occurs directly after someone has experienced a traumatic event. Symptoms of ASD can include intrusive, recurring, and distressing memories or dreams of the traumatic event, feeling as though they are reliving the traumatic event, which is also known as flashbacks, intense responses to internal or external reminders of the traumatic event, inability to experience positive emotions, feeling disconnected from self or time, inability to remember everything about the traumatic event, trying to avoid thoughts and feelings related to the traumatic event, trying to avoid people, places, objects, smells, or the like that remind them of the traumatic event, problems with sleep, such as inability to fall asleep or trouble staying asleep, irritability and angry outbursts, which could be physical or verbal, hypervigilance or always being on the lookout, inability to concentrate, and easily startled. ASD can show up anytime between 3 days and 1 month after a traumatic event. If these symptoms continue, then it becomes PTSD. Post-traumatic stress disorder, or PTSD, is the more long-lasting form of ASD. As such, all of the symptoms of ASD are also symptoms of PTSD. However, PTSD can also include the following symptoms that are not a part of ASD. Negative beliefs or expectations about the world, such as a negative worldview, distorted thoughts and beliefs about the cause of the traumatic event, leading them to blame themselves or others, loss of interest or participation in their normal activities, feeling detached from others, and reckless or self-destructive behavior. As you may be able to tell while going through the possible symptoms of ASD and PTSD, trauma can also be associated with other mental health disorders. Trauma can often cause or exacerbate depression. Depression can also include symptoms like sleep problems, difficulty concentrating, irritability, inability to experience positive emotions, and difficulty with memories like ASD and PTSD. However, depression includes many other symptoms not associated with ASD and PTSD. Anxiety also has many overlaps with ASD and PTSD and can be also caused or exacerbated by trauma. For example, anxiety can appear as being on edge, difficulty concentrating, irritability, and sleep problems. However, anxiety can have other symptoms that do not overlap with trauma responses as well. Trauma and the resulting mental health impacts can cause people to seek an escape or way of controlling their mental state. In doing so, people can sometimes turn to substances. While some substances can be helpful, such as anxiety or depression medication or certain natural alternatives, others can be harmful, particularly when consumed in large quantities or over a length of time. Even helpful substances can be harmful if consumed in too large of a quantity or over too long a length of time. Some people begin with helpful substances but cannot continue to do so for largely financial reasons and end up turning to other, more harmful substances. Other people are prescribed way too much helpful medication by medical professionals and become dependent. It is important to remember when interacting with and creating policies for patrons who use substances that there is usually a reason why they ended up using. Trauma can also appear very similarly to attention deficit hyperactivity disorder, or ADHD. Like with ASD and PTSD, ADHD can cause an inability to concentrate and memory problems. Trauma can also impact executive functioning more generally, causing further symptoms of ADHD like problems with maintaining attention on a task, difficulty organizing objects or time management, and problems with losing things frequently. Children are particularly likely to show symptoms of trauma in a way that can be confused with ADHD. So before we end, I want to make sure to hit the point that only a fraction of those who experience trauma develop PTSD or another mental health disorder. However, trauma can still have lasting impacts that do not rise to the level of a diagnosable disorder. Once again, library professionals are not qualified to diagnose patrons, and that should not be your job. You already do enough on your own. These overviews of mental health issues that are common among those who have experienced trauma is only meant to inform library professionals so that you might better understand those who walk through your doors. If you have any questions about any of the topics that we covered, please feel free to continue on to these links that I have here in our additional learning section. Otherwise, I will see you in the next recording.